Hello everyone, welcome to Daily Pathology. So today's topic is journey of leukocytes. So we will learn how the leukocyte mature and what is left shift in peripheral smear as well as what is right shift in peripheral smear in this video. So let's start. First is classification of leukocyte lineage. Very important, you should know this. In this, leukocytes are divided into granular cells and second is agranular cells. In granular cells, it is divided into three types of cells. First is neutrophil, then second is eosinophil, and third is basophil. In neutrophil, again, mature by 6 stage of maturation. Here you go. And eosinophil and basophils mature by 4 stages of maturation. Next are agranular cells, which is of two types, that is lymphocytes and monocytes, which both mature by 3-stage maturation. This is the universal rule of cellular maturation in leukocyte. As the leukocyte start to mature, overall cell size is decreased, it becomes smaller. The nucleus to cytoplasmic ratio is also decreases, which is called as NC ratio, which is decreased. Then chromatin becomes coarse and condensed. As you can see, here is a open chromatin and it goes towards maturation, then it becomes coarse and highly condensed chromatin. Must remember this. Next is cytoplasm mature and changes in color. Here you can see a basophilic cytoplasm, and as it matures it becomes eosinophilic, that is pink in color. Lastly, there is distinct granules begin to appear in the cytoplasm of the cells, which we will learn further ahead. So remember these 5 rules of cellular maturation. So next we will learn neutrophil maturation. It is divided into 2 phases, phase 1 and phase 2. So in phase 1 there is a proliferation and early development, which include blast cell, promyelocyte and myelocyte. Blast is the most immature form of neutrophil and its size is 12 to 20 micrometer. The NC ratio is very high in the blast because nucleus is of larger size compared to that of the cytoplasm. That is approximately 4:1. Fine chromatin is there, you can see in the image. This is a fine chromatin, and you can appreciate 2 to 5 nucleoli. These are the nucleoli, these two nucleoli in the blast. You can see 2 to 5 nucleoli in myeloblast. The cytoplasm is deep blue in color and a granular cytoplasm. Very important point. This is a granular cytoplasm. There are no granules and deeply basophilic, as you can see. This is the first recognizable precursor in the immature series, blast. Next is the promyelocyte, which is of larger size than the blast. It is 15 to 25 micrometer. NC ratio is small, that is 3:1 compared to the blast. Large nucleoli present. Here you can see these are the nucleoli in the cells. And abundant cytoplasm, remember, abundant cytoplasm compared to blast, abundant cytoplasm. And it contains primary or azurophilic granules start to appear in this cell. There is no granules in the blast, but the promyelocyte shows the granules, and it is the largest cell in the sequence of maturation of neutrophil. Next cell is our myelocyte. Myelocyte is the of size 10 to 18 micrometer. NC ratio is 2:1 approximately, and round to oval cell, as you can see in the image, and eccentric nucleus towards the away from the center towards the periphery. There is no nucleoli. There is no nucleoli in the cell. Chromatin is coarse chromatin. Specific, also called neutrophilic or eosinophilic granules, starts to appear in this myelocyte stage, and It is the last stage capable of mitosis. So it is an important point to remember. So I created a mnemonic. You can remember by myelocyte makes more. So it is the last cell to capable of mitosis. And first stage where lineage specific granules you can identify. That's like you can identify it as a neutrophilic cell or eosinophilic precursor or basophilic precursor depending on the color of the granules. Like in eosinophil you can see orange red granules, in neutrophil you can see pink lilac granules, and basophilic dark purple granules. That's how you identified the lineage from this myelocyte stage. Next phase is the nuclear maturation and specialization. In this, there are three cells: metamyelocyte, band form, also called stab cell, and lastly is our most mature cell is neutrophil. So first we will learn metamyelocyte. In metamyelocyte, size is 10 to 15 micrometer. Nuclear cytoplasmic ratio is approximately 1:1. Coarse chromatin, no nucleoli. Key identifying feature is kidney shaped nucleus. And how should you differentiate it from the band? That is, indented nucleus is of less than 50% of the nuclear size. If it is equal to 50% or greater than 50% indentation, then we say it as a band form or stab form. Numerous specific granules are present in metamyelocyte. Next is our stab cell or band form. Size is 9 to 15 micrometer. No nuclear segmentation is seen because nuclear segmentation is a feature of neutrophil. It should be smooth, band shape, headphone like nucleus. You can see here, you can appreciate this is a headphone like nucleus or a band. Key feature is C shaped, S shaped, or band shaped nucleus. Normally it is of less than 5% or 10% of circulating WBCs. According to various literature, there are different percentage, but less than 5% is considered as a normal on an average. Next is the most mature cell in the series is neutrophil, which has a pink cytoplasm, fine primary and secondary granules. Here these are the granules, and lifespan of neutrophil in blood is 6 to 10 hours, you can see, and in tissue it is 1 to 2 days. Key feature, it has a 2 to 5 lobes. These are the lobes or segmentations in the nucleus and connected by strands, and more circulating. This is the mature circulating neutrophil. This is the table I created. Contains all the values. You should remember this and identifying features. Next is the fully formed polymorpho nuclear neutrophil features. Let's say diameter is 12 to 16 micrometer, as we learned earlier, and granules contain mix of both primary and secondary granules. So these are the granules. Here you can see these are the granules, which we can see as a pink lilac granules, ready for immune response. Then cytoplasm display a distinct pink hue indicative of full maturation. This is the pink hue, which is indicating of maturation. The nucleus is dark purple, highly condensed, and chromatin is divided into 2 to 5 distinct lobes. Poly means many and morph means shape, so it refers to multilobated nucleus. Remember this. So lastly, the left shift. Always say in the clinical practice, what does it mean and why does left shift occur in the body? So the left shift means there is increased immature neutrophil precursor in the peripheral blood smear, as we learned earlier, from neutrophil towards the blast. It is a left shift. Why does it occur? Because physiological stress create a demand driven surge. Here you can see, and bone marrow is forced to release immature neutrophils, most commonly band cells, into the circulation before they are fully lobed in the bone marrow. So increase in bone marrow stimulation leads to left shift. And diagnostic anchor is normal band cell count is, as I said earlier, less than 5 to 10% of WBC, and a dramatic increase above this threshold is a definitive marker of left shift. So why does it occur? What are the clinical triggers? So few of them are severe bacterial infection, sepsis, inflammation, pregnancy. There are many more causes, but these are commonly we can get in our clinical practice. So if we get a more percentage of band, that is say greater than 5% or greater than 10%, then we can suspect a early bacterial infection in the patient, so rule out that. Then if we get a left shift up to metamyelocyte stage in the peripheral smear, you can see for example in the pneumonia patient. Then if you get a shift up to the myelocyte, then you can commonly see this in the sepsis and leukemoid reaction. Then if you get left shift up to promyelocyte or even up to the blast, then you can see this in most commonly acute leukemia, then CML blast crisis and severe marrow stress. If there, you can also get a few of the blast. So always correlate with the clinical symptom of the patient and the signs. Then what is the right shift? So we learn what is the left shift, but right shift means there is more mature neutrophils in the blood, like hypersegmented neutrophils, which is a criteria uh, if greater than 3 to 5 lobes and if greater than 6 lobes. So this is the criteria for hypersegmented. If we get more hypersegmented, we call it as a shift to left. There are various conditions. Most commonly, we can see this in megaloblastic anemia in our day-to-day clinical practice due to vitamin B12 deficiency or folate deficiency. Remember this. So in this video, we learn leukocytes divided into granular and agranular. Then 5 universal rules of cellular maturation, very important. Then maturation from most immature cell blast up to the mature cell neutrophil. And this is the chart, important for you guys. Next is fully formed polymorphonuclear neutrophil and the very important left shift in the clinical practice. So I hope this will help you in your future peripheral smear examination. All the best. Thank you.